I'm gonna do my hand hygiene and then I'm gonna enter the patient's room. Hello, I'm Taylor. I'm a third year nursing student from UBCO. I'm here to do your Foley insertion today. Is that okay? Great. Can you tell me your full name and your date of birth? Awesome. I'm just gonna check that on your wristband here and that looks good. So have you had a Foley inserted before? No? Okay. So essentially what we're going to do is we're going to insert a catheter into your urethra. And I know you haven't been able to pee lately, so that's gonna help us release the pee from your bladder and provide you with some comfort. Do you have any questions? Perfect. Do you have an allergy to latex or iodine? No? Okay. Well, I'm gonna start by getting you all set up here. So I'm gonna provide privacy in the room and raise up the bed to the correct working height. And then I'm gonna lift up the blanket here and I'm only gonna be exposing the peri area and no more than I need to. And we'll start by getting you positioned. So if I could just get you to lift up your knees, you can put your feet together and then you can relax your knees outwards. And you can just stay relaxed like that for the duration of the procedure. So now I'm going to put on clean gloves and provide peri care. Once that's done, I will discard of my gloves and I can get my equipment set up. So this is the catheter bag. I would just place it between the patient's legs. And then I also have my catheter and my stat lock here and of course my sterile dressing kit. So now I'm going to open my sterile dressing tray. Gonna move this over so I have more room and I can begin taking out my equipment. So I have my sterile gloves, a specimen container in case I needed to do a specimen on my patient. And at this time I can place my catheter into my sterile field. So typically this would be all closed up and I'd be taking caution to make sure I don't contaminate the catheter. Perfect. And at this time, I can put on my sterile gloves. Great, now that I have my sterile gloves on, I can place this pad below the patient. I'm going to place the shiny side down. And the important thing here is to make sure you maintain sterility with your gloves. And again, the same thing with this pad. We're gonna do shiny side down and being careful not to touch the patient at this time. Okay, now move the tray in between my patient's legs and get the catheter ready. So I can take it out of the bag. And what I'm going to do is put one end on the sterile water. And the other end I'll put in my lubricant. At this time, I would also open up my iodine packages, but I'm not using iodine for this video. I'm just using these pink swabs instead. Okay, so I'm going to open up your labia now. I'm going to use my non-dominant hand, and now I can begin to clean the vagina. So I'm going to start at the top to bottom and do one side of the labia, the other side of the labia, and then straight down the middle. Once that's all clean, I'm ready to insert the catheter, so I'm going to remove it from the loop. And I'm going to insert the catheter now, so if you can just take a couple deep breaths for me and let me know if you feel any pain. So I'm going to insert the catheter 4 centimeters. I should get some urine return, and then I would insert 5 more. At this time, I'm ready to inflate the catheter, so I'm going to move my hand here to maintain the position. And inflate the balloon. Now I'm going to want to pull back the catheter and make sure that it's in place. And I can disconnect my syringe. If I was going to take a specimen, now is when I would do that, but since I'm not, I can just attach the catheter to the catheter bag. Typically this would have a sterile cap, so everything would remain sterile. At this time, I can dispose of my equipment around the patient. And before I cover them up, I'm just going to provide a wipe and make sure there's no more lubricant or iodine there. And then I can use the stat lock to secure the catheter to the patient's leg and hang the bag on the bed. Before I leave the room, I'm going to note the color of the urine that came out of the patient, the clarity, and how much. And I'm also going to document how the patient tolerated the procedure, the size of the catheter, and the amount of sterile water that went into the balloon. So I'm going to document all that once I leave the room, but before I do, I'm just going to make sure the patient is comfortable, lower their bed back down to a safe height, and ensure their call bell is in reach.